Thank you. People have said that with the pandemic, they've had to get used to the idea of what exponential growth looks like. Apparently, there's been exponential growth in the sales of Albert Camus' The Plague, that have roughly paralleled the rise in the COVID cases. And Camus said, the pestilence is at once blight and revelation. It brings the hidden truth of a corrupt world to the surface. Maybe corrupt world is too strong, but my view of the pandemic is that it exposes the inequalities in society and amplifies them. And as you said, Debbie, in February, I published the Marmot Review 10 years on. And the fundamental idea, and it's not very different to Richard Layard's fundamental truth, which is that health tells us something very important about the nature of society, and health inequalities tell us something very important about inequalities in society. So I documented in my 10 years on review that life expectancy had more or less stopped improving, health inequalities continued to get bigger, and life expectancy for women in the poorest 10% of areas outside London actually declined. Wow, that's appalling. Health stopped improving, health inequalities got bigger, and life expectancy for the poorest women outside London got worse. If you agree with my general proposition that health and health inequalities are telling us something fundamental about the nature of society, the nature of society stopped improving and inequalities in society got bigger. And then COVID-19 comes along and exaggerates all of that in an utterly predictable way. We know that the impact of lockdown has exaggerated inequalities, that people, key workers, have to go out to work or lose their jobs. I saw figures today, both from the UK and the US, that the effect of lockdown has been to shift wealth upwards. Richer households can't spend all that money that they used to spend on luxuries and enjoyment, so their wealth has increased. And because they're not spending that money, the poorer people who are servicing those industries are out of work or on a furlough scheme that reimburses part of their employment. And so they've been spending their wealth. So the inequalities have got bigger. And then we've exposed the mortality in BAME communities. And what the data show on mortality from COVID-19 is that there's a social gradient. The more deprived the area, the higher the mortality, that looks roughly parallel with a social gradient from all-cause mortality. In other words, the determinants of inequalities in health more generally overlap markedly with the determinants of inequalities in COVID-19. There's a bit of a bigger excess at the bottom end because I think of overcrowding and key workers in frontline occupations being exposed to COVID-19. So what does Build Back Better look like? Number one, and Richard and I think are in total agreement, is taking a well-being approach to the economy, not saying building back better means getting back to the status quo. The status quo was not desirable before the pandemic came. That's what my 2020 report showed. It was not desirable. We needed to do things better. So this is the opportunity to do it better. And I made a whole set of specific recommendations of what that looks like. So if we put well-being at the heart of what we want to achieve, how do we get there? Well, to take the first 5 of my 6 from 2010, invest in early child development, education and lifelong learning. We know that the spending on education per pupil went down over the last 10 years. And with COVID-19, The inequalities in educational outcome will be exaggerated. It's like a prolonged summer effect, having children not in school. So we're going to have to put extra effort at redressing the inequalities in educational outcome. The third was employment and working conditions. And one thing we've learned, and please, please don't forget what we've learned, is how important to society and to all our lives are the drivers and the delivery people and the care workers and the people on the front line and the cashiers in the supermarket. We've learned how valuable they are. We don't value them in terms of pay. We just realize that our lives would collapse without them. So part of employment and working conditions is thinking about the word care workers. Why would we pay people a miserable wage to look after the valuable members of our society at older age? I've always made the case about early childhood that we need to have properly trained people to be involved in early child development. Like in Finland, master's degrees would be a good idea. I would say we need to have people with proper job security and proper training to be care workers for people of older age. Absolutely vital. The fourth was income. Everyone should have at least the minimum income necessary for a healthy life. And the fifth was healthy and sustainable places to live and work. And I loved everything that Dawn said. And the idea that communities are not an instrument to something else. I take the same view about health. It's not an instrument to something else. It's important in and of itself. I've probably been guilty of thinking of community as an instrument to getting better health, but I'm suitably chastised by what you said. Community is of value in and of itself, but I can predict that flourishing communities will correlate with better health. That will be a good outcome. So I think we actually know what to do. Reviewing the evidence, and I wouldn't I, but I'd push those 5 domains that I've just mentioned, because if we want to get practical about how to put well-being at the heart of building back better, then we need to invest in those 5 domains and build a better society. And then I can tell you, health will start improving again and health inequalities will diminish.